Hello, my name is Julia Negron, and this presentation will discuss some of the challenges that an organization may face when adopting an electronic health record. To me, this image helps exemplify the vision of the electronic health record, or EHR, as this almighty magical source of healthcare information. To some, perhaps those from an older generation not familiar with technology, it's a formidable beast to conquer. To others, likely from the millennial generation, it is an essential system that provides efficient and thorough documentation. However, challenges related to interoperability, usability, and health IT safety affect the adoption of an EHR, no matter the user. The transition from paper to electronic documentation can be daunting for an organization. While it makes sense to condense the row of paper files into a well-organized and easily accessible electronic format, the creation and implementation of an EHR needs to consider several factors, including interoperability with existing systems, usability, and health IT safety. An image like this provides high-level basic benefits of an EHR over paper documentation. Something like this might be useful to share with staff outside the circle of implementation to gain their buy-in to the electronic system. I'd now like to go visit Epic's website. Epic is one of the largest electronic health record vendors in healthcare. As you can see from Epic's webpage, it offers software for multiple healthcare system needs, including patient engagement, clinical applications, specialties, mobile applications, care at a distance, which also includes population health and connection with the community. It also has applications to manage revenue cycles, managed care, interoperability, and government regulations. Despite all these really cool features and obvious benefits, there are significant challenges when implementing an EHR. As previously mentioned, these include interoperability, usability, and health IT safety. DALI 2016 takes recommendations from Epic and provides this visual of guiding principles and objectives to follow when implementing an EHR. The challenges of interoperability, usability, and safety are embedded in the listed guiding principles. The listed objectives provide goals that an organization can use to ensure that they are addressing the principles and challenges of implementing the EHR. Houston Rasiq 2014 notes, organizations must be aware of the variety of potential perils to mitigate risk and patient harm when implementing an EHR. She also notes that patient harm can result in medical malpractice claims stemming from EHR insufficiencies and errors, and organizations and providers can face legal fines and lawsuits for privacy breaches with the EHR. To achieve desired outcomes for EHR implementation, several factors need to be considered. What drivers or motivation for the change can be used to guide the objectives of the implementation? What regulations and policies help support not only the implementation, but the continued success of the EHR? Lastly, what technical components are needed to ease the workflow changes anticipated with new technology? Houston Rasiq discussed the implementation of an EHR at a hospital in California. Needs were assessed by interviewing key nursing and executive leaders within the medical center. The needs of the organization were categorized into three main areas: additional resources, both human and financial, physician buy-in, and nurse collaboration, not only during the system build, but during the implementation and training phases as well. A SWOT analysis was created to illustrate opportunities and threats relative to implementing an EHR. DeOcar and Senecar 2016 have a large list of recommendations for successful implementation of an EHR. They note key factors like communication, workflow, and quality as the key factors that make implementation difficult. I appreciate that management of the implementation takes into consideration not just technology management, but management support, process delineation, project management, change management, and lastly, technology management. In conclusion, EHR implementation certainly has significant challenges, but Do benefits outweigh the risk and challenge? According to healthit.gov, benefits of an EHR include improved patient care, increased patient participation, improved care coordination, improved diagnostics and patient outcomes, practice efficiencies, and cost savings. To me, the benefits and impact of an EHR certainly outweigh the challenges and risk. Thank you.